This revision of the social care workforce will definitely have great benefits moving forward. With regards to a continuous learning and development framework, in a word, yes. Obviously that's a new thing to us today, but what we're hearing is something that's very, very positive. I think staff at entry level will benefit greatly from something like this in the future. The Health and Safety and Certificate Initiative is something that the new staff will definitely benefit from. That's definitely something that's going to help retain people in the sector longer, so that knowledge will be there for us much longer, and also then people with ambition will be able to stay with us and achieve the ambitions that they do have.
It's important for everybody to be involved in the sector and the development of qualifications. It's about trying to make sure that all sectors are represented in developing the qualifications and developing the practice certificate. A transferable certificate's really good. It's going to be a very positive thing, but there needs to be consistency across all sectors to make sure that we're all represented appropriately and that there's a good quality assurance, because if registrants are going to be moving between different organisations, it'll certainly cut down on the initial training, all of those types of things, but we need to make sure there's consistency across all sectors and that there's quality assurance of any qualifications like that. I was involved because I'm part of the vocational training team, and we represent the trusts. There are other trusts there as well, representatives there as well, but we have other people from the statutory sector, and also it's important that the colleges are involved, so that all sectors. It's really important that we have a standardised approach. The qualification's robust and meaningful within the sector. It'll reduce some of the duplication of training of staff who kind of go between different organisations, or when you get a member of staff in, if they come with a practice qualification which has been quality assured and it's a solid qualification, then they should be able to come in and hit the ground running. That they have their medication, their health and safety, their manual handling, all of those qualifications are within that, so it'll stop the duplication and hopefully then increase the professionalism of registrants and of social care.
I feel that it was necessary. It's something that we can add to our suite of qualifications. It saves staff then having to do health and safety, like fire safety, moving and handling, and if they happen to move somewhere else, that they have to repeat it again. So I think it's good that we will do something that will not have to be repeated, that can be transferred if they move somewhere else. We've been very involved. We have been asked to contribute, not just from our own trust perspective or where we work. We've been asked to then look at what others have and get together and share our information and our experiences. So it has been a very collaborative experience, so it has.
I found the Health and Safety Practice Certificate very interesting. I think it's going to be very beneficial for organisations, that you can transfer skills and abilities across and help with our induction process. If staff come across and have this certificate, I think it's going to be more time to focus on our service users and learning and development supporting them, because they already have the transfer skills coming across.
As a service manager, I would be involved in training quite a bit and induction. I've recently inducted a staff member, support assistant, who has come from a different organisation. That was difficult because she had just recently did a lot of her training, and that now has to be redone with myself. That can be difficult for people because they've just done all that, and now I've been asking them to do it again. So yes, I think the Health and Safety Certificate will be good for transferable skills.
I think that's really important, that social care workers get the opportunity to be recognised for what they do and what the values that they bring to the job.
This will definitely supportive to the social care workforce to develop their capacity, and I strongly believe the standards and the capabilities of the staff members, especially in the social care sector, is going to be improved.
Well, the aim is to deliver a thriving social care workforce that's fit for the purpose and fit to take on a lot of delegated roles that may come its way, the challenges within society at the minute of supporting people and live really good lives in their community. So we need to continue to work with the workforce, to listen to them, we need to support them, we need to promote them, we need to ensure that their voice is heard within the system, not just their voice, but the solutions they have to support the very difficult challenges that are ahead within our National Health Service. We know there are huge issues around people not being able to get the support to leave hospital. This workforce is really, really important around providing and enabling care delivered in people's homes, as well as freeing up really expensive resources in terms of the acute sector and other professional parts of the system. So it's a really important workforce to get right going forward and to develop and to resource. That's where we need to go.